So, strategies for addressing. Quickly, let's talk about them. Ageism can be combated. Through policy and law, we can protect human rights and address age discrimination and inequality. Through educational activities, we can try to help, like what we are doing right now through this self-learning module, is to try to imbue in you information and to understand what is ageism and how we can address it and provide hopefully some skills to enhance empathy with our older adults. And then there are intergenerational interventions in terms of connecting with people of different generations. In the Bridge program, we are starting what we call the Intergenerational Learning Collaborative with medical students, where we're trying to get them to go to senior centers and to establish a relationship and learn from our healthy, vibrant, active senior center clients so that we can chip away at this this perception that all older adults are frail and terribly sick. But look, exposure to ageism means that you need to step up and you need to say something, okay? So we need to recognize that that exposure to these stereotypes does not mean you endorse it, but it can affect the way in which your brain works during these interactions. So you need to be vigilant and to also, say something. If you hear something, say something, right? In terms of, hey, that was ageist, and call out your peers. And if it's an attending, there are many thoughtful ways in terms of giving attendings feedback anonymously. One of the models for reducing ageism is called the PEACE model, Positive Education About Aging and Contact Experiences. And this was developed by Sherry Levy, and this model was developed to improve health and well-being of individuals across the age continuum. And the PEACE model focuses on two contributing factors: education about aging, including positive older role models that can dispel some of these negative, inaccurate perceptions, and then also literally physical contact. We can't live our lives in segregated little bubbles. If you plan on going into medicine, the majority of the patients that all of us are going to see in the future to come are going to be older adults. So it's really important that we don't make them invisible, but that we try to engage and have contact with older adults. And the truth is, a lot of our students, our trainees, you are engaging with a lot of high-functioning, older, mature adults, such as myself, and so we should be those role models in terms of someone who is approaching 60 who is still vibrant and active. So what are the benefits for intergenerational practice? We decrease ageism. We help to improve better physical health, better mental health. We fortify some of these social connections. We develop new skills, and we ultimately have improved well-being for our older adults. So there are a plethora of intergenerational activities that we can pursue: sharing music, performing, discovering technology, challenging stereotypes, being physically active. And that is my presentation today. I will make all of my references available. And this is actually a source of a lot of the slides that I used today, the Global Report on Ageism, sponsored by the World Health Organization. So thank you, and thank you for participating in this self-learning module. Thank you.